Christus Trinity Clinic in Hope. I think that we're all aware of the issues that have been created by COVID-19 in our community. So I'd like to take a minute to talk to you about some of the things we can do to help keep our families, ourselves, and our children safe. Everyone knows about the vaccine. I think the vaccine's safe. I think it's a very effective way to minimize transmission of the virus. I think it's also helpful to keep yourself safe and avoid being hospitalized or severely ill from the virus. Some people have made the choice not to get vaccinated. I think that some things they can do to help protect themselves and protect other people in the community is wear a mask, wash your hands, keep yourself at safe distances from people, at least 6 feet apart. Try to avoid large crowds. Even for those people that are vaccinated, wearing a mask does prevent some transmission of the virus. I don't think there's any one thing that completely will eradicate this virus, but I think that a lot of little things that we all can do can really make a big difference in preventing the spread of this terrible virus around our community.
My name is Dr. Goins. I've been a physician here in Hope, Arkansas for 41 years. And I have to say that dealing with the COVID pandemic has been the most difficult medical crisis I've had to deal with. Yesterday, 41 people in Arkansas died from COVID infections. 2,200 new people developed the infection in Arkansas. 23,000 people are infected right now with the COVID infection. The infection has spread much more rapidly than it was previously. We're going into an upsurge. It's primarily due to the new Delta virus. Hempstead County right now has 113 cases. So it's definitely impacting our community. In the past year and a half, we've had about 20 residents from Hempstead County who have died as a result of the COVID infection. Some of them were relatively healthy and young. Each of you probably know at least one of those members. You'd think with all those people dying that there'd be more people getting out to get immunized, but the immunization rate for Hempstead County is very low. It's one of the lowest in the states. Immunization rates for the entire state of Arkansas is one of the lowest in the countries. In Hempstead County right now, only 21% of people have been vaccinated. That's only about 1 out of 5 people who are eligible for the vaccinations. Now I know that a lot of people have concerns about the vaccine. They've heard rumors or stories about the potential for side effects or even death from the vaccine. But what you don't realize is that the infection itself causes heart damage. The infection causes lung damage. The infection causes blood clots. The infection causes death. So we've given about 2 billion vaccinations around the world in the past 9 months, and the incidence of side effects from the vaccine are very low. When you compare it to the incidence of damage from the infection, thousands of times more damage is caused by infection than has ever been caused by vaccines. So we want everyone to get out, to get past this hesitancy, get past this fear. We want people to get out and get the vaccines. They're available throughout the community. Several of the pharmacies have them available even without appointments. You can also get them at the health department. You can get them at the Bobcat Clinic at the high school. Pafford Clinic offers them also. Also, I want everyone to know that if you have any symptoms at all, if you're getting sinus congestion, cough, sore throat, nausea, vomiting, diarrhea, fever, chills, loss of taste, loss of smell, you need to get tested. And then you need to quarantine yourself until you get your test results and your symptoms go away. Everyone needs to get past this fear, and we all need to get vaccinated to protect ourselves, protect our family members, and to protect our county. Thank you.
Hi, I'm Dr. Allyson Hanson here at Christus Trinity Clinic in Hope. I want to advise everybody in Hempstead County and encourage y'all to go out, get the COVID vaccination, wear your mask, follow with hand hygiene, avoid large crowds if possible. The COVID pandemic is really taking hold in this area, and these are small interventions that we can make to help decrease the impact that it has on Hempstead County.
Dr. LaDell Douglas. I'm a pediatrician here in Holt, Arkansas for the past 27 years. I've been asked to give my perspective on this current COVID-19 situation as it pertains to children. What we need to understand is that our children are our most vulnerable population at this time. Understanding that those less than 12 cannot be vaccinated, and very few of those 12 to 18 are getting vaccinated. So what this leaves us with is a problem of coronavirus 19 spreading throughout our school system with this open school year, unless we have school mandates for masking every child and teachers and staff. They need to be 3 feet apart, they need to be good hand washing, and they need to practice as much personal hygiene as possible in order to prevent the spread. What we do know is that for the past month, there has been at least a 950% increase in the number of cases in children 5 to 18. And that's since July to August. A 950% increase in those cases. We also know that there have been 3 deaths of children in Arkansas due to COVID. And we also know that Arkansas Children's Hospital right now is working at about 85% capacity in its PIC unit. They have a total capacity of 27 beds. Right now they have 26 patients in the pediatric intensive care unit, of which 23 are COVID patients. That means that they have about 4 beds open, and schools have just started. That is an alarming factor in that, in fact, we are now number 4. Arkansas is number 4 in the active cases per day right now in the country, only to be led by Mississippi, Alabama, and Louisiana. We're number 4. So we only have about 39% of the people in the state are fully vaccinated. So we need to continue to encourage people. Forget your political affiliation. Think about the health of your kids and yourself. If you have a parent who's out working, not vaccinated, they have a chance of bringing it home to their little kids who are probably not vaccinated or can't get vaccinated. Or if you don't require them to wear their mask at school, then they can pick it up at school and bring it home to the parent, the grandparent, another relative. So the idea of wearing a mask is basically it's a healthcare issue. Just like wearing your seatbelt. You put on a seatbelt to protect yourself. Put on a mask to protect yourself. Not only you, but those around you, those which you love and care about. So we also have to consider that we was to start a school, there's going to be physical, social activities like athletics. There are certain things that the coaches and staff need to consider in terms of athletic programs. They need to be periodic testing to making sure that there's not being a case that's overlooked and then there's a spread throughout the whole squad and then they all end up in quarantine. So it is very important that we look at the public health issue, understanding that we are not out of this yet. We have a long ways to go. School is just starting. We're now seeing an increase in another childhood virus called RSV, which we don't normally see, probably November, December. Well, it started early this year. So now we have kids with both respiratory syncytial virus, RSV, which is a respiratory thing. A lot of these babies have to go into the hospital. So we got those in the hospital, COVID's in the hospital, we are getting overloaded. Now, then we think about November, December, the flu season, which we haven't had yet. So we've got issues here the next 5 or 6 months that's going to tax our healthcare system. And we all need to be aware that we need to do as much as we can to prevent the spread of these diseases. I thank you for this opportunity. Please get your vaccination if at all possible.
So the vaccine allows us to create what I refer to as memory cells. Officially they're called antibodies, that allows your body to mount a response faster, and it's a more profound response to produce those memory cells so that hopefully you will not get as sick as you normally would.
Back in December of 2020, healthcare providers in the state of Arkansas were offered the COVID vaccine. I, without hesitation, made the decision to take the COVID vaccine in December, and I'm very glad and very fortunate that I did. I had spent the whole year of 2020 dealing with COVID on the ambulance across the state of Arkansas, and had saw firsthand the effects of it, how it's affected our hospitals, how it's affected our providers, and how it's affected the patients that we pick up on the ambulance. So there never was a doubt in my mind that taking the COVID vaccine was the right thing to do. I put my trust in science, I put my trust in medicine, and took the vaccine. I've had no side effects from taking the vaccine. I feel like that was the right thing to do for me, for my family, for my coworkers, and for my fellow citizens. There's never been a time in our life that taking two small shots 2 weeks apart has ever been so important as it is now. The only way to be able to stop the spread of COVID, to keep more people from dying, and to free up hospital bed space is to become vaccinated. You not only have to do it for yourself, you have to do it for your family, for your friends, and for those fellow citizens in the communities.
My name is Devin Shephard. I'm a nurse practitioner working here at the Chris's Trinity Clinic with Dr. Bennett and Dr. Hanson. Over the past several weeks, we've had a significant increase in COVID. Our community is much like the state. A large portion is unvaccinated, and as such, we've seen a lot of patients who are more sick compared to this time last year if they are infected with the Delta variant. And right now we're trying to do the best we can to urge everyone to get the vaccine. If you're adamantly opposed to the vaccine, wear your mask, social distance, try to minimize contact with other people, and just kind of do everything we can to try to slow this down and hopefully kind of minimize the strain on our hospitals and urgent cares and clinics and everything like that.
I am Christine Holt, the new chancellor at the University of Arkansas Holt Texarkana. Even though I'm a newer member of the community, I am just as vested and invested in the community. So with that being said, we all must do what we need to do. We must be committed to helping get rid of the virus. And what that means is we must take precautions, we must take measures. I can tell you from an educator's point of view, and working with our students, if they contract the virus, that could impact their education. It might mean that they may have to stay home for a couple of weeks, and that means they're out of class and they're missing very, very important instruction. And yes, we can do other things, but it's not as critical for them to be a part of the classroom environment. And even if they're online, if they're away from instruction, they'll miss some critical components. So it's very important that we do what we need to take care of and to handle the virus. Now with that said, I'm very pleased to have my colleague who has served as the interim chancellor, Laura Clark. Not only was she the interim chancellor, but she's also trained as a nurse. And I'd like to ask her advice. What would she advise the community?
Yes, vaccinations are so important, especially for our students who are attending college here. We know that vaccinations help prevent not just them from catching COVID and it getting worse, but it actually prevents some of the quarantines. And as you know, it is more difficult to attend class or take class online than it is from coming to campus. So what we're just asking you to do, if you're straddling the fence or you're not really sure about the vaccine, to seek your information from those who have a scientific background. And that would be your physicians or your pharmacists or someone in the healthcare field that you know and trust. They will give you the facts regarding the vaccine.
Good morning. My name is Phillip Turner, and I'm the athletic director and football coach at Hope High School. I just want to encourage everyone to try to get vaccinated and to wear your mask, because this virus is serious. And we just want everyone to be safe. We want our kids to have a closest normal school year as we possibly can. Thank you, and go get vaccinated.
Good morning. My name is Mark Ross, United States Army National Guard veteran of 23 years. And I'm here today to discuss the COVID-19 vaccinations. It's important to me for more people to get vaccinated because we have an elderly community here in Holt, and I feel that we need to be protecting them as well as the rest of the community. And I really encourage our veterans to come out and also get vaccinated, because a lot of people in Hope, Arkansas has a lot of underlying conditions, and we need to make sure that Hope and Hempstead County stays healthy.
That's a tough question. It's important, not just to me, but for our entire community. At this point, I have lost count of how many patients that we have lost in our community, not to mention our individual pharmacy. We're exposing not just older people, but our children, people in their 20s and 30s that we're losing, and it happens very, very quickly. The more people that are immunized, the less likely we are to spread it to each other. We're not anywhere close to getting to herd immunity at this point, which means that people who choose to remain unvaccinated will be protected by those around them. We're not anywhere near where we need to be for that to even be a discussion. So it's just crucial at this point that we get people vaccinated.
My wife and my children are all been vaccinated. They've never had a question about it. They never once thought that this is something that we shouldn't do. They put their trust in me of 29 years in the medical field, of knowing that taking the vaccine and taking it as quick as possible was the right thing to do. So I encourage everybody out there to follow everybody else's lead, see that the medical profession is doing everything that we can to fight COVID. We can't do this alone. We have to have the population to help us by getting vaccinated, by wearing your mask, and by stopping the spread. And the only way we can do this is to work together. The medical field has to provide the care, but the population, the citizens of this city, of this county, and this state have to do their part by becoming vaccinated.
It's important to me because I want our kids to finish a school year. I want everyone to be safe because I have little ones that's in school as well. And I want everyone to be protected. And because I've seen what this virus has done to family members and friends. And I just want everyone to get vaccinated, research it, and just, hey, let's protect everyone.
So the vaccine, right now we have 3 different options in the United States. We have the Johnson & Johnson, the Pfizer, and the Moderna. Each of these vaccines, if you have the current recommended dose, may help slow the transmission a little bit. The big benefit right now is that if you do have the vaccine and you become infected with the Delta variant, you're at much lower risk of having a severe illness. The CDC is recommending beginning today that after 8 months of your initial vaccination with the Pfizer or Moderna vaccine to have a 3rd booster dose, and that may actually provide some protection to reduce transmission rates. So everything's kind of a wait and see type thing, but at this point, with the amount of infections that we've had and some of the severity of the symptoms, we're trying to be as proactive as we can to slow this down and hopefully keep everyone safe and healthy.
Everybody in the medical profession is tired. We have been fighting a disease for almost 2 years now. We're wore out, we're stressed, we're faced with this every day. We have what's called in the EMS field a mass casualty incident. A mass casualty incident is where you have more victims than you have the resources to be able to sustain it. Usually that is on a very small level, a local level, where you have a bus accident with 20 victims that have to go to the hospital. That overwhelms your EMS, and it also overwhelms that local hospital. We're dealing with a mass casualty incident that is happening every day, every hour, in every community across the state. And we have been doing this for a very long period of time. Our healthcare workers have stood up, come to work every day with a brave face and fought this and worked through it every day. But everybody is tired. Everybody is running on very little to no sleep. They're having to pull extra shifts. They're having to pull very long shifts dealing with multiple patients. And the emotional and mental toll that this disease has caused is starting to show its effects in our healthcare profession.
I didn't hesitate when the vaccine first became available back in December. I got my first shot. My second one was in January, and it's because I know that vaccinations do help prevent viral infections, and this is the best weapon we have against those. What we found out is that the virus is very resistant and spreads very rapidly, and the people who've died from it or been critically ill is the main reason I feel the vaccines are important.
So last year I spent 11 months working in critical care, and some of those patients were COVID positive patients. Initially I was a little bit hesitant about the vaccine, but after working for months and months with these patients one-on-one, watching them be on ventilators, managing their medications, watching them code before your eyes, watching families find out the news when they didn't even get to be with it just the devastation and the collateral damage that this virus has done, and seeing it one-on-one with patients who are not a statistic. These are real people, and they have real lives, and to lose that it's unthinkable what I've witnessed personally, and I wouldn't wish it on anybody else.
In my practice every day, I look at the risk and benefit of everything I do for my patients. When I look at data that supports the safety of this vaccine versus some of the risk that I see with severe illness related to this virus, I feel like I was better off vaccinated to protect myself and to protect my family and to protect my patients, and I really just felt like any potential small risk associated with the vaccine are much less risky than any problems that I'm going to see long term with COVID virus.
Every day we are faced with a tremendous task of finding bed space for patients that are suffering COVID, suffering heart attacks, strokes, and trauma. We're quickly running out of beds in Arkansas. We have run out of beds in surrounding states. It's to the point now where if you are seriously injured, ill, we're not going to be able to find a bed for you. The only way to relieve this stress of our hospitals and our medical staff is for everybody to become vaccinated. And also to think about your friends and your family. And what would you want for them? Do you want them to be stuck in a situation where they've suffered a major heart attack and there's not a bed available for that person to go to because the beds are occupied by people who have COVID?
So when it comes to something like a vaccine, especially something that was produced pretty quickly compared to some of the other vaccines in the past, there is a lot of hesitancy or concern about getting it and being almost like an experiment subject. But if you actually look back, the mRNA vaccine is not a new concept, and there's also a lot of data that's been released by all of the companies that have produced a vaccine. So I felt like the safety compared to possibly contracting COVID and either becoming critically ill or having a long-term effect from COVID, I thought it made a lot of sense to me to get the vaccine and reduce my risk. We're seeing now that people who have had COVID, it's not uncommon to have some longer lasting effects, particularly with heart problems, lung problems, and now we're seeing that there may be some cognitive issues associated with long haul COVID or an after effect of having the COVID infection.
The biggest reason is my mom and father are 89 and 90 years old, and I would not want to go to them and give them the COVID myself. I've encouraged them to get a vaccination, which they have, and my entire family. And I, again, encourage all veterans of Hope in Hempstead County and all the other citizens of Hope in Hempstead County to get this vaccination because you're protecting your community, your families, and all your other friends. Do not listen to the people that does not know what they're talking about. There's a lot of negative talk about the COVID-19 vaccination. Talk to your doctor or other healthcare workers and get their opinions, not the outsiders.
As a pharmacist, I totally understand people's reservations, but if they'll talk to some people who, whether it's their physician or their pharmacist, someone in the medical field that they trust, and that they don't listen to misinformation, that is key. There is a ton of misinformation. I have people send me questions, articles. They read information that they don't understand, and they try to interpret that and extrapolate. It's not correct in any form or fashion. They need to talk to people who know what immunology is, who know what vaccines are and what viruses do and what they're capable of doing. It's a really intense subject, and you need somebody who can break that down for you that you trust, that's going to give you correct information, and that doesn't really have any sort of other motive involved.
My encouragement is I've got vaccinated. I've had no issues. If you're skeptical, research it. Talk to family members that's vaccinated, because this virus is serious, and we need to protect our community, our schools, and all our loved ones.
Well, I understand, because many of my patients have those same questions, and I've talked to those patients about that. And I understand the fears, and I've read the literature. I've read the stories about people who've died, and I can't discount all of those. But I do know that the incidence of death and serious illness from the infection is so much worse than the risk that you would have with a vaccination.